In the coming weeks and months, Congress will be engaged in the difficult issue of how best to reform health care in America. I'm committed to building a transparent process where all views are welcome, but I'm also committed to ensuring that whatever plan we design upholds three basic principles. First, the rising costs of health care must be brought down. Second, Americans must have the freedom to keep whatever doctor and health care plan they have, or to choose a new doctor or health care plan if they want it. And third, all Americans must have quality, affordable health care. These are principles that I expect to see upheld at any comprehensive health care reform bill that's sent to my desk. I mentioned it to the groups that were here today. It's reform that is an imperative for America's economic future and reform that is a pillar of the new foundation we seek to build for our economy. In the last 8 years, premiums have grown 4 times faster than wages. And in each of these years, 1 million more Americans have lost their health insurance. It is one of the major reasons why small businesses close their doors and corporations ship jobs overseas. And it is one of the largest and fastest growing parts of our budget. Given these facts, we can no longer afford to put health care reform on hold. We can't afford to do it. It's time. As Speaker Pelosi just mentioned, the House is working to pass a comprehensive health care reform bill by July 31st, before they head out for the August recess. And that's the kind of urgency and determination that we need to achieve what I believe will be historic legislation. As I've said before, and as all Americans know, our health care system is broken. It's unsustainable for families, for businesses. It is unsustainable for the federal government and state governments. My mother passed away from ovarian cancer a little over a decade ago. And in the last weeks of her life, when she was coming to grips with her own mortality and showing extraordinary courage just to get through each day, she was spending too much time worrying about whether her health insurance would cover her bills. So I know what it's like to see a loved one who's suffering, but also having to deal with a broken healthcare system. I know that pain is shared by millions of Americans all across this country. And that's why I was committed to healthcare reform as a presidential candidate. That's why healthcare reform is a key priority to this presidency. That's why I will not rest until the dream of healthcare reform is finally achieved in the United States of America. After decades of rising costs, I believe that real healthcare reform is finally possible. Today, I'm working to build a diverse coalition to support this effort, and partners have already stepped forward who have never worked together before. But the most important seat at the table belongs to you. To get this done, I need your voice to be part of the debate, and it needs to happen now. That's what Organizing for America is all about. There will be well-funded efforts loudly proclaiming that reform isn't possible, eager to mislead people about what real healthcare reform actually means. The most powerful way to break through that noise in Washington is for millions of ordinary people to speak up and say, "You demand healthcare reform now," and to explain why it matters so much in your lives. So right now, please add your name if you too support the 3 core principles I've laid out for healthcare reform. And share your personal story about why controlling costs, guaranteeing choice, and ensuring affordable, high-quality care is so important in your life and the lives of your loved ones. I'll be personally reading many of these stories, and I'll make sure they are shared with members of Congress. If you speak up now, your voice will make a difference. But please stay involved with OFA for many other ways to make a difference on this and other crucial issues we face. Of course, passing real healthcare reform will be hard. It's a challenge that's vexed this great nation for generations. But I know, and you know, that when we work together, we can do extraordinary things. Let's make it happen, this time.
Hi everyone, my name is Adisu Demesi, and I'm the Political Director for Organizing for America. On behalf of everyone at OFA, I'd like to welcome you to today's Health Care Organizing Kickoff event. Thank you for taking the time to be part of this historic effort. Before we begin, I'd like to ask you to take a second to think about what you're doing here. The event you're at right now is one of thousands of events taking place in living rooms and coffee shops across this country. There are literally tens of thousands of people just like you, who took time out of their days to talk about healthcare, to chart a plan and to take action to reform our broken system. Our goal is simple: sending real, comprehensive healthcare reform to the President's desk by the end of this year. I know we can do it. President Obama said it best. This is our big chance, not only to deliver the change we desperately need, but to show people in Washington that the days of politics as usual are over. It starts today, and it starts with you. The work you'll be doing today sets the tone for our work in the weeks ahead. There are 3 things you can do today to kick off our Organizing for Healthcare campaign. First, practice sharing your personal healthcare story. It's important for each of you to be able to articulate what this effort means to you. Your story is the most valuable tool in your arsenal as you talk to your friends and your neighbors about the urgent need for reform. Second, review President Obama's healthcare reform principles. The President has demanded that any plan lowers costs, guarantees patient choice, and ensures quality, affordable coverage for all. We cannot and we will not compromise on these principles, and we must demand that Congress act this year. As the President said on a call with volunteers last week, it's now or never. Third, make a plan for action. Organizing for America is planning a National Healthcare Day of Service on June 27th. We're also beginning to make neighbor-to-neighbor outreach calls to have real conversations about the need for healthcare reform now. The Day of Service is a way for you to showcase the need for healthcare reform in your community. Be sure to carve out time to brainstorm ideas for healthcare-related service events in your area. Think about activities that will promote the President's principles, strengthen your local organization, and help your community in the process. After you have a service event planned, you can begin to use our neighbor-to-neighbor tools to contact citizens in your neighborhood, to invite them to your event and to talk to them about the President's healthcare principles. Schedule times to meet together to make these calls. This type of person-to-person outreach elected President Obama. Now we're using those same tactics to bring healthcare to tens of millions of Americans. We know reforming our healthcare system is a huge task, and we know it won't be easy. But the campaign taught us that there is nothing more persuasive than having a friend or a neighbor make the case for change. And that is exactly what you are about to do. For 60 years, we've talked about reforming our healthcare system, and for 60 years, we have come up short. But not this time. This time, the President is going to have the voices of millions like you behind him. This time, people like you are going to get out there and educate and persuade your neighbors. This time, we'll counter the lies and the distortions with facts and with the real stories of people who can't afford to wait one more day for things to change. It starts today, it starts here, and it starts with you. So thanks again for coming to this Healthcare Organizing Kickoff and for everything you've done and will continue to do to change this country.